Hello, and welcome to our broadcast. I'm Natalia Covarrubias Eckhart. I'm the inpatient medical director for rehab and pain management at St. Jude in Fullerton, and I'm going to be co hosting today's discussion. As a reminder, the information provided during this event is for informational purposes only. For any specific medical questions, please reach out to your primary care physician or your healthcare professional. Today, co-hosting with me is Dr. David LeGroux. He is the Executive Medical Director for Women's Services at St. Joseph Health. Thank you for joining me today.
Oh, my pleasure.
So to get us started, Dr. LeGroux, please let us know what you do in your role with St. Joseph Health.
Yeah, so my official title is Medical Director for the Women's and Children's Clinical Institute here in Southern California. So in that role, my job, of course, is to help coordinate both our hospitals and ministries and the medical group activities on different clinical parameters around women's and children's health. During the COVID epidemic, I've taken upon the role to be the one to sort of coordinate the efforts as far as sharing and socializing information about what's going on in the region with COVID. What are the latest recommendations from our major societies like the American College OBGYN, Society of Maternal Fetal Medicine, American Academy of Pediatrics. So sharing the statistics, sharing the experiences, helping with as mundane things as, hey, where are we going to get enough tests and what should you be doing, those types of things. So it's been a real journey, but also it's also enriched me in getting to work with our providers and caregivers through the region and support them. So it's been a journey.
I'm sure it sounds like it has been. It's been a change here too. So I'm glad that you've been able to support our region with that.
Yeah.
What has been your experience with pregnant women or new mothers who have gotten COVID?
Well, I think it's interesting because I would say our experience here in Southern California has been very, very similar to the nation as a whole, the state as a whole. We've had the surges. We have seen those and dealt with the deluge of sick mothers. We've seen people, we do routine screening on admission to the hospital for our pregnant women. So we've seen people completely without symptoms. And unfortunately, we've gone the other spectrum and seen women severely ill. And unfortunately, we have seen maternal deaths from this. So I think, it's real. It's out there. I can assure you that our folks have had to put up with the whole thing. But the bottom line is this has been a real hit to pregnant women, and unfortunately, the effects passed along to their babies. With respect to preterm birth and some of the other complications. So it's been an issue.
And do pregnant women have any different risks involved with contracting COVID?
What we found and seen, as has been reported in the literature, is that pregnant women can develop and have a more severe course than if they weren't pregnant. And so there are a few other illnesses like influenza where pregnancy seems to set women up for more complications. So in COVID in particular, it's been the respiratory symptoms such as pneumonia and difficulty breathing. So increased numbers of moms going into the intensive care, increased moms going on the ventilator, increased moms with blood clots and other complications. So we certainly have seen that happen, unfortunately.
So I know you mentioned that women that are pregnant can have more severe course, but does it matter how far along they are within their pregnancy?
Yeah, it's really interesting, and it is, changed a little bit of our counseling on things like vaccination. And the reason I say that is it seems to be the severely affected women tend to be in the middle part of their pregnancy, somewhere around 24 to 32, perhaps 34 weeks, where they really seem to get the sickest. So what that means for us in our counseling about, hey, get the vaccine, it's, hey, get it before that time period, of course, to try to avoid that. On the other end, later in pregnancy, we certainly have seen people get sick and of course, had to deliver them, things of that nature. But it's really that middle of the pregnancy that we are the most concerned about.
And if a pregnant mom does get COVID, does it mean that she automatically gives it to her baby?
No. Fortunately, one of the good things about this virus, unlike some other things, for example, Zika, remember we went through that a couple years ago, the transmission rate across the placenta seems to be pretty low. So we're not seeing birth defects. We're not seeing, things of that nature. If the mother herself doesn't get sick, it doesn't seem to cause direct problems to her fetus. In other words, if she gets sick enough to lower oxygen in her blood or things of that nature, obviously that's, the mother is breathing for herself and her baby, right? So the bottom line is that can affect it. But as far as directly transmitting, not a huge problem. And even at birth, we think most of the transmission happens afterwards. In other words, the mother breathing, the baby breathing that in. But overall, the number of babies we've seen, we obviously test the babies, right? Because there are a few of them, but most of them have not been culture positive and actually done pretty well.
And just curious, for the babies that are born to moms who have had COVID, do these babies have immunity if they've received the vaccine or their moms have had COVID?
They do. Actually, when you get vaccinated, the primary antibodies you produce are called IgG. And I know that you know that, but I'm sure there's ones on the call that don't. But IgG antibodies do cross the placenta and do get in the baby. So one of the things we tell our moms when we're counseling about vaccination is, hey, not only are you protecting yourself, but you're also giving what we call passive immunity. In other words, the transfer over to the baby. So it makes it less likely when newborn babies come out, their immune system is not up to speed, so to speak. So it's a really good thing for them to have these antibodies.
Yeah. And speaking as a new nursing mother, do you know, is there any data that breast milk provides immunity to COVID?
Yeah, we think it does. Obviously, the biggest benefit in a breastfeeding mother of either having, some natural immunity from a prior infection or from vaccination is the fact she's not going to get COVID or not be as infectious if she is a breakthrough infection. But there's also evidence that the antibodies get over into breast milk. And theoretically, since it is sort of an oral or you're breathing it in, that should give some immunity to the baby. So that's a good thing.
It's very good to hear. And what should a mom do if she thinks she's been exposed to COVID or she starts to feel symptoms?
So just like a non-pregnant person, first thing to do is isolate yourself, right? If you think you've had it, please do not, go out and share it, right? That's sort of common sense. If they develop symptoms, they certainly should let their caregiver know, their obstetrician or their midwife or whoever. Keep them appraised of it. The ACOG has put together a very good algorithm for how we as providers handle that. In other words, if someone's exposed, they're having very, very mild symptoms, we don't just rush them into the office because, again, we don't want to contaminate other patients and ourselves. But obviously, we temper that by what we were talking about earlier, is the fact that they are at risk to get severe disease. So we do encourage, if the symptoms get bad enough, for folks to come in. They're also candidates for monoclonal antibody therapy. You know, the drug that actually gives them, infuses antibodies against the COVID. And we give it, but again, to these folks who are just on the edge of potentially needing hospitalization, et cetera. So again, we definitely want to know about it. We definitely want to do it. But the biggest thing is, you know, again, to reduce the spread. And then, of course, the other thing is encourage the people around her to go out and get vaccinated so that they potentially won't get it or spread it.
And I know you mentioned vaccines before, but I've got a couple questions, and it sounds like some questions are coming in as well. Is it safe for pregnant women to get the vaccine? And what are your thoughts about boosters in pregnancy?
Yeah, so there's a number of things to talk about the safety of the vaccines in pregnancy. Obviously, they were not as all the time. Whenever vaccines are tested, they don't start with pregnant women for obvious reasons. But there were pregnant women in the trials. In other words, you know, they're human too, right? So they got pregnant and things of that nature. And the one bit of credit I will give to the CDC is they have been tracking, if you get the vaccine and you know you're pregnant, they not only have been tracking everyone who does that, but they specifically have reached out to a number of pregnant women and followed those pregnancies closely. And the data we have is very encouraging. The symptoms you get from the vaccine, of course, are very similar to non-pregnant and things of that nature, but there's been no increase in miscarriage, no increase in stillbirth or prematurity or poor pregnancy outcome. And based upon that, and again, weighing that against the increased severity of COVID in pregnancy, it really, you know, the safety, you know, risk-benefit ratio really weighs on the side of recommending vaccination during pregnancy. And then the last issue probably that people, you know, has come up because there was early on, you know, and it mainly made it through social media, but a concern about, hey, is this similar to a placental hormone, and is this going to cause miscarriages? And again, first of all, the similarity between those two things is really not thought to be enough to cause problems. And like I say, we now have really pretty good numbers to show miscarriage rates do not go up with vaccination. So if you're planning pregnancy, we also recommend going ahead and getting the vaccine.
Perfect. You actually answered a couple questions.
Oh.
And there was another one that came in that said, I mean, it sounds like you answered this one too. Do you believe all pregnant women should get the vaccine?
Obviously, I'm biased. You know, I don't think you see the stories and you see the women that have gotten sick and not be moved by that. I mean, you know, believe it or not, right? Doctors are human, and so I am biased. But yeah, like you say, I think, you know, if this had been in January and I'd gotten that question, I probably would have said, wow, let's see how things go. But now with the data we've seen and the experiences we've had, I think, you know, the head of ACOG put it best. He said now we're at the point we should enthusiastically support giving all pregnant women vaccine. So again, that's not to say, as anything in medicine, there's always some downside risk, right? In other words, there may be a rare case here, a rare case there. But if you just ask me for all women in general, it's kind of a no-brainer. And then I think if we go back to our conversation about the beneficial effect to not only this baby, but the other children. See, I think the other thing we got to remember here is many pregnant women, obviously if it's not their first, are going to be around young children that likely are not vaccinated. So it's just a good group. I tell people, I think we have, or I certainly have read more information about this vaccine than all the other vaccines that we give in pregnancy probably combined. Again, every bit of data we have now is strongly supported.
Yeah, that's good. I would agree. It seems like everyone's really looking into the data. And another question came in is if you could speak to the studies of women being able to get pregnant after getting the Pfizer vaccine.
Yeah, again, there's no evidence that the Society for Reproductive Endocrinology strongly supports vaccination as well. Again, it kind of gets back to what I was saying about the placental, again, these two German researchers who said, wait a second, you're creating antibodies that will target the placenta and make infertility go up. And again, that just has not panned out. And there's none of the data that we've seen have supported that. So again, I think like you say, our recommendation, whether you're planning pregnancy or whether you're having a pregnancy, and certainly, the other way to kind of look at that is if you get sick enough, that may influence your ability to get pregnant later on. If you get a big blood clot or you have, severe illness with your lungs and things of that nature, that's going to probably do a lot more effect, I think, long term to your reproductive ability than anything we can imagine from the vaccines.
That's a good point. And I think one last question, I think you may have touched on it, but I just want to be clear. Is fetal development affected when expecting moms get COVID vaccine?
No. And again, the antibodies that are getting across, much like if it was a natural COVID infection, right? The antibodies getting across into the baby are thought to be beneficial. So if anything, we really think it's much safer for the baby. And the vaccine itself, particularly the mRNA, if the mRNA gets free, quote unquote, out of the muscle cells in your arm where you get the shot, mRNA doesn't last but a few seconds out in your blood. It's broken down and to components and things of that nature. So there's nothing to think we're affecting the baby at all.
Okay. Those are very good questions coming in.
Yeah, no, good, happy to answer. Dr. Cohen, let's turn it around. Tell us about what your role in all this has been. What do you do for our health system?
So I'm at St. Jude in Fullerton, and I do inpatient rehab for patients who have strokes or brain injuries, and more recently, because of COVID, people who have been having sequela from COVID as well. So I mostly work within the hospital in our inpatient rehab unit, but then I do continue to see these people outpatient and follow them depending on their deficits or impairments.
And my understanding is actually you tested the system during a pregnancy, right? Recently, while we were going through all this. And I think, just by the way, before you answer and tell us your experience, that was one of the hardest things, I think, for us as caregivers to restrict visitation and make all the changes and and walk into a patient's room looking like we were something out of a science fiction movie with the PPE. But tell it, how did it feel as a patient?
Yeah, I would agree. So just on as the physician side, even on the inpatient rehab unit, being the person to say, no, you can't have visitors, it's really hard. But being a patient was interesting. So as my second pregnancy and birth, the first one I had before COVID, so I got to see what normal medicine would look like within the hospital. And then my second one was interesting. So my first one, I had a doula present and my husband present while I was in the hospital. And the second one, I was told I couldn't have a doula because of the visitor restrictions, which was frustrating, but I understood the concerns. And because as a working physician within the system, I had to say the same thing to my patients. We made it work by actually having virtual visitation with my doula, and she was available on call if I needed to during the birth as well. So that was nice. I'm very comfortable within the hospital system, and everyone within the hospital is really nice, even with the restrictions, and made me feel really safe.
Yeah, it's funny. I'm going to follow up that one because you hit one of the magic words we learned about, right? Was telemedicine and how we could. So did you, obviously you said you used that in the hospital. What about any of your prenatal visits get switched over, or any of your care that way get changed?
No, the only issue was my husband not being present, which was sad because he couldn't see the ultrasounds. But I did all of my prenatal visits in person. So the care was, they were very comprehensive, made sure that I get all the testing, ultrasounds that I needed before the actual birth.
Yeah. Well, and again, I think going forward, that's probably one of the things we'll learn. Now, you were in a hospital, and obviously, at that time, we had active COVID patients in the hospital. How safe did you feel? Was that a concern? Was it, wait a second, it's what about me? What about my baby? Tell us about that.
So interestingly enough, when I work as a physician within the hospital and there was COVID cases, because I was seeing COVID within our hospital as consults, I said I felt more comfortable in the hospital than I felt outside of the hospital. And that's because within the hospital, we all had equipment to prevent the caregivers from getting it and the patients from getting it. So everyone was doing good hand hygiene. They're wearing their masks or their face shields, gowns if appropriate or needed. And so that's why I felt so comfortable within the hospital giving birth. When I would go outside and go to the grocery store, and who knows the person next to me, if they're wearing a mask or not, if they're symptomatic or not, I never knew. So in the hospital, at least I had those barriers to protect me. And then also because of COVID testing, it was also nice to know if people were positive or not. So if there's other patients, they would isolate those patients away from the mother baby unit, and they would keep them away from other sicker patients.
So what would you tell your caregivers? Now put on your patient gown, and what would you tell them to do different, or how could we have made the experience better?
Honestly, it was a good experience. Everyone did their job. They were all very supportive. Everyone was wearing their mask appropriately because I was very overprotective about that. And so, if someone's mask is below their nose, I would ask them to put up. That never happened in the hospital. The only thing that is different, so obviously within labor, when it got to the point where I was really uncomfortable because I was going natural, I could not wear my mask anymore. And it was really uncomfortable. And They didn't harass me about taking it off. Everyone else was wearing their appropriate PPE to prevent them, but they were nice to allow me to be able to take it off for that time when I could not bear to have it on my face. Obviously, I wore it as much as possible, but there are circumstances.
And when did you deliver? I know I'm violating HIPAA here.
No?
Just
okay.
General.
April.
Yeah, April. So hopefully most of your caregivers, right, were vaccinated by that point. Because I will tell you, turn into flipping it around for the caregivers, because you mentioned it, or, keeping pregnant women who are pushing, in a mask or whatever, you got to be kidding, right? So So the point being that, you can imagine for those caregivers, the relief they felt once they had been vaccinated. I
Of
think,
course.
I've heard that from nurses and physicians and other folks that had to be in the room. So that's an important, really important point.
I
Now,
agree.
now you got to put your white coat back on and tell
Mhm,
me a little bit about your work with the long haulers, because
mhm.
I think what people don't realize about this pandemic is what a big deal the long haulers and going forward we're going to deal with. So can you give us some info on that?
Yeah. So the nice thing is I do see these patients on the full spectrum. So I do see the ones that are in the hospital who've been on ventilators with breathing tubes, who've had myopathies or muscle and nerve weakness, and they do go through acute rehab if they're weak enough. And then I also see the ones that are home, have never been hospitalized, had a diagnosis of COVID and never really sought care, but then later had some symptoms of some fatigue. So I do see the whole spectrum. The difficult part is that people aren't realizing that if you get COVID, there is a high likelihood that you could have symptoms long term. And so that's why a lot of healthcare professionals are pushing for the vaccine. Although, great that it does prevent death and bad outcomes, but it also prevents the chance that you're going to have long haulers, most likely, because you're not going to have the severity of the symptoms. So for the patients with long haulers, I'm seeing them with fatigue, difficulty concentrating, difficulty getting in and out of bed. They just can't do their basic activities, and they have a variety of symptoms. And there's a huge long list that we've compiled. And so every patient is really different. They are getting better, which is the good thing. So we've been applying techniques of rehab that we use in chronic fatigue syndrome and in cancer rehab to these patients, and they are having better outcomes. So they are able to walk further distances, able to get back to their daily routines after some therapy. So they are improving, which is a good sign. We are still doing more research. So we are trying to find out if there's other modalities that might help, but at least we have something that works for them in the interim.
Yeah, I can't imagine taking care of a new baby and breastfeeding and all the things that hit new mothers with long
Hmm.
haul syndrome. It's got to be a huge deal for those folks.
Yep, having a newborn is work enough.
Yeah, really. Anything else? What else have we not talked about?
I would say, from my perspective, that even if you haven't been diagnosed formally with COVID, if you ever thought that you had COVID and you have symptoms, that someone should seek treatment to make sure that they get back to the life that they had before. I think that's the biggest piece from just treating long hauler patients, is that they're hesitant to get treatment and that we can help them.
Yeah, and I think the best data I've seen is the vaccines at least half your risk of being a
Hmm.
long hauler.
Yep.
So, another reason that we're supporting vaccination is the long
Agreed.
haul and the effects that's going to have on those folks. Great.
Yeah. All right. Well, thank you, Dr. LeGroux, for joining us today, and for everyone listening and sending in your questions. To learn more about our initiatives, our programs, and our services, or ways to give, or if you're looking for medical care, please visit us at providence.org. And make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram, and under Providence on Twitter. Thank you.
Thank you.